anger and irritability problems, problems with relationships. Again, these can occur with everyday ordinary depression too. Lack of interest, trouble concentrating, feeling overwhelmed or out of control. That's another one. And then physical symptoms that occur, like headache, breast tenderness, joint pain, bloating, and things like that. Now, you might wonder, is this PMS? You know, what's the difference between PMS and premenstrual dysphoric disorder? PMS is again, it's sort of like the baby blues kind of. When you compare that to postpartum depression, it's the same kind of thing as comparing to PMS to premenstrual dysphoric disorder. But basically, it's not as severe. You can have a lot of the same symptoms, and they don't typically interfere with function as badly as premenstrual dysphoric disorder does. Women who, remember I said that women who have difficulty with sudden hormonal changes are at risk for, like, so for instance, I guess let me just get straight to the point. A woman who has this PMDD is at higher risk to have a postpartum depressive episode. So let's put it that way. And also, you know, for like if a hysterectomy occurs or something like that, those are high-risk periods. It's estimated to occur in about 3 to 5% of women. Usually starts in the teens to late 20s, and then it usually seems to worsen with age and then cease with menopause. So it goes away with menopause, which shouldn't surprise anyone because the hormones at that point are sputtering out. You have to make sure, before you go diagnosing this, you have to make sure that it's not related to something else. You know, that it's not a full-blown depression, or it's not a bipolar disorder, or some anxiety disorder, personality problem, something like that. Because those things would all be treated differently. And you don't want to, you know, use an antidepressant necessarily right off the bat in a person with bipolar disorder, because you might make them worse. The outcome in this case, I'll read this outcome to you. The patient's family doctor recognizes this as more than just PMS, premenstrual syndrome, and diagnoses premenstrural dysphoric disorder. There's a lot of acronyms and different big words in this talk. Now that I have to give the talk, I kind of realize that. So after discussion with the patient and also charting of her monthly menstrual cycle and mood changes, which also is very important, by the way. Because how do you know? I mean, you kind of have to know concretely if this starts a week before the period and ends with the period, or right after that. I mean, because if there are other episodes of depression and stuff in between, then it's probably not this disorder. So you got to chart stuff. The physician then recommends an antidepressant starting a week before the symptoms usually begin and stopping with the period. So really, in some cases, you can get by with using an antidepressant 2 weeks a month. You know, and then you stop it. The symptoms improve 75% over what they were, which allows her to save her job and increases her function and quality of life. So in this case, you know, the treatment helped her. Now, I gave you all positive cases here, so you're probably thinking, yeah, right, doc. You know, like I'm sure everybody gets better and that kind of thing. But and of course, not everybody gets better. I would say everybody gets better eventually, but not on the first swing like that. So, but those were examples. Questions? Does anybody have any questions about it, really any of this stuff or any other topic? That's pretty much the end at this point.
I noticed when this first came to my attention, it was through a friend who said she was going through it, and her doctor had given her that type of dosing.
This is the premenstrual dysphoric disorder.
Yeah, the PMDD, and her OB had said, you know, take this a week prior and continue through this cycle, and so it was the 2 week. And then after about several months, they changed it to now just take it continuously for a month. And so now that seems to be what at least our doctors are doing. Is they're giving it, you know, it's usually Seraphin is their choice.
Yeah.
Or Zoloft, I believe, is another one they use in there. And then now they're just saying, just take it every day, daily.
Yeah.
And so I don't know if that's just our doctors doing it that way, or
no. I think
it's a common.
A couple of issues with the every 2 week thing. Okay. One issue with every 2 weeks is that you have to remember, you know, it may be easier if you get in a routine of taking something every single day. Okay, if you do it you just do it 2 weeks out of the month, then you're not in a routine, or it's harder to be in a routine. So sometimes folks forget to take it. Another issue is that some of the medicines are kind of short-acting, so when you start and stop all of a sudden, especially when you stop, you get some withdrawal symptoms and things, which are uncomfortable and patients don't like. Serafim doesn't have that issue because it's longer-acting. Zoloft, too, you can have some withdrawal, but I would think after 2 weeks, and since it does have a little longer activity in the body, you probably wouldn't have as much trouble with withdrawal. But another thing that can happen is that you try the 2 weeks, and for whatever reason, any of those reasons, it doesn't work out for you, and then they say just take it all month long, And sometimes doctors, just for ease in their minds of trying to remember when are they on it, when are they not on it, they would prescribe it, and the person takes it every day.
So during the period of time when they're not suffering with the PMDD symptoms, it's still okay to be on an antidepressant. It's not going to affect them.
Oh, is it going to hurt?
Or is it going to affect them in any other way? Or
it shouldn't. If you give somebody an antidepressant who doesn't have depression, outside of the side effects, you might have side effects like anybody that takes any medicine, really. You can have side effects from it, but it doesn't, it wouldn't, if your chemicals, I suppose, if you want to think of it that way, the chemical imbalance theory and all this, if they're already, I don't want to say normal, yeah, I guess, functioning as best that they can, or to their optimum for you as an individual, you're probably not going to notice. Like, it's not like somebody's going to. I think there was a myth out there that folks that took Prozac, they'd get happy no matter how they felt. I mean, if they're already happy to start with, they're probably not going to feel much happier, So it isn't going to hurt outside of the side effects, probably, to take it during those 2 weeks. I mean, really, the advantage. I think a lot of people are just they don't like taking medicine, So if you can tell somebody, look, you can take this for 2 weeks, then you're off. Sometimes psychologically that people like that a little better. And that's okay. I mean, I think as long as it works, I think it's worth trying it. And if it doesn't work so well, then you go to then you take it all month long. So does that answer your question? Okay. Yeah.
Well, how about, since you say it takes so long for an antidepressant to take effect?
Yes.
How does it work if you just take 2 weeks and then
$64,000 question, isn't it? That's a great question, and let me repeat it. The question is, we have a smart audience member out here, but the question is, yeah, Doc, you said these things take 6 to 8 weeks to work. Well, how the heck are they going to work in 2 weeks? And then you stop, and then you start. 2 weeks later you start it again. How's it going to work? The answer is I don't think we know how that happens. But it's been studied and it does help. So these medicines, they work on the chemicals in the brain, okay? And we know that. When they do that, like let's talk about the newer ones. Let's talk about serotonin medicines, okay? Serotonin is one of the chemicals in the brain. When you take a medicine like Zoloft or some of these others you talked about, Serafim, the serotonin gets boosted within 3 days, okay? Why does it take 6 to 12 weeks for effect, right? Because it's not just increasing the serotonin, I don't think, anyway, in my mind, and most of the other docs, scientists' minds. It isn't just increasing the serotonin that treats it. It's probably that, which then kicks in something else. It's a cascade of events that has to occur, which is why it takes that long to work. What's different about that with PMDD? I don't know. It's certainly hormonal, right? So is there some effect directly of serotonin on the hormonal system? Is it somehow regulating that system in some way? It could be. It could be. I don't know the answer.
So if it works, maybe it is confirming the diagnosis that PMDD.
Yeah, if it works, I would say if it works for those 2 weeks and then you stop it and it for the other 2 weeks and the person is doing just fine, it's pretty likely that's really what it was, is PMDD. If you try it and it doesn't work out, it maybe it's more like a major depression that just gets worse premenstrually. Because I have had a lot of folks like that. They have depressive episodes and they just get really, really worse premenstrually. Then when you treat them, their depressive episodes, they get a lot better.